I'm Breda Queally. I was diagnosed with von Willebrand's at the age of 35. Well, now I suppose you have to take into account that this was the 50s, 60s, and I lived in the country, and I was the child in the family that was delicate. Reason why I was getting all these nosebleeds. I was horrific nosebleeds, and I can remember distinctly, and I would bleed from both nostrils, and then eventually it would abruptly stop. But my first, I suppose, traumatic experience was at the age of 8. I had to have teeth extracted, and I got a horrific bleed. So there wasn't any dentist to call, so it was my GP that was called at the time, and he proceeded to stitch my gums. No anesthetic, nothing. So that memory at this stage of my life, still with me. I don't like dentists. Dentists don't like me. So like during my teenage years, I had a very, very heavy periods. Nobody took any note of them. I didn't, because I presumed everybody else was the same. I didn't have the situation of a lot of pain, and I used to take Anadine. Anadine was the tablet to take then for pain, which contains aspirin, which I shouldn't have been taking. I was prone to get root abscess in my teeth. Now, the dentist tried to do root filling, didn't work. Tooth had to be extracted. I tell them I bleed a lot, it doesn't heal. They say, oh, right, okay, we know what to do. I always found dentists so dismissive. They just, you opened your mouth and they took it out and they, filled it up, and then it wouldn't heal. Anytime I had a tooth extracted, it took 2 weeks before I could eat properly. That's not an exaggeration. And dentists, 3 dentists in my life told me, sorry, I don't want to treat you again. So you walk out, where do I go if I have another problem? And the teeth, it was ongoing. I lost half my teeth, really. Then I suppose the next would be like with friends talking, and that I then realized I was having these heavy periods. None of my friends were having them, because my periods were lasting about a fortnight. So I went to my GP and he said, look, yes, you seem to have a lot of bleeding and whatever. And he said, look, my advice to you is have a baby and we'll sort it all at 21 or 22. That was my advice then, but So then I got married later, 5 or 6 years later, and pregnant with my first baby. No problem whatsoever in the pregnancy, none whatsoever, because I was having no periods. And that was fine until 2 months after the baby was born. Oh my God, the hemorrhaging started again. Worse than ever. And it went on. When back then I had a different GP, I was living in a different part of the country. And there was no just heavy periods. And he sent me back to the gynecologist after about 6-8 months. Gynecologist said, right, okay, examine me, said, you have a tear in your womb, you need a womb repair, and that will sort it. Most awful surgery, and the wound didn't heal. Got an infection in the wound, and took a while for it to heal, but it didn't stop the hemorrhaging. So 4 years later, I had my second baby, and about a year and a half to 2 years after he was born, I had a perforated ulcer. Ended up in hospital, blood transfusions. I went into hospital the 14th of December, and I came out on the 5th of January. But on the 10th of January, I got a horrific hemorrhage. It was Saturday evening, taken to hospital, blood transfusions, Saturday night, Sunday, couldn't stop it, had a hysterectomy on Monday morning. Got a hemorrhage again. Didn't know where it was coming from. Back to theatre, had a second surgery, and I was told I was bleeding out through 2 stitches. So I had to, I don't know what they did, back again, intensive care for nearly a week. I was in hospital for 2.5 months. They wouldn't let me get out of bed because in case I had a hemorrhage again. And that was it. There was still nothing. I still had no blood test. Nobody investigated it. Nothing. Until that May, abscess in a tooth. And it was then I spent 2 or 3 hours in a dentist chair trying to stop the bleeding. It was bleeding out through the bone. My GP was called, different GP at this stage was called, gave me a morphine injection, sent me home, and they kept in contact all night. And the next day he phoned and he said, we have to do something about this at this stage. So I was sent to the hospital to have a blood test done, and I was diagnosed with von Willebrand's at the age of 35 in May 1983. I would honestly say it must have been in the 80s, really, that the GP at the time sent me to the hospital because of the, I had 12 months of an awful lot of bleeding, And obviously it must have been known before that, but just, I suppose it's up to your GP to send you. I wasn't aware that, that there was such a thing as a bleeding disorder. At that stage, both my parents had passed away, so I don't know, it's a genetic disorder, so I don't know which parent I got it from. But subsequently, my 2 sons were tested, and 1 son has von Willebrand's. The diagnosis was in 1983, and really nothing happened between 83 and 96. Nothing. I just had this diagnosis. But, and at that stage as well, you must remember, I had had a hysterectomy, so I had no periods. But in 1996, an ad came on TV. I remember sitting down, and it was a seminar that was run in Jury's Hotel by the Irish Haemophilia Association and St. James's Hospital. So I just went along myself to that, and it was the best day of my life. It's getting it organized. Like, it's okay, I have a diagnosis of von Willebrand's and I have to get treatment while it is a treatment intravenously. But like, to get that set up, the coagulation unit in the hospital has to link up with the consultant, and it has to be done. It isn't a matter of going in, getting something done and home. So I'm still okay, I have a diagnosis, and while it works for me, but I still have to fight my corner. I would say you just have to sit there and say, no, I'm not leaving until you do this, this, this. That advice I would have as well for any women, anyone that has a diagnosis of von Willebrand's, to join the Haemophilia Society. They are absolutely amazing as a backup, and you can ring them anytime, and their conferences and their talks and everything are absolutely fantastic.